implants if I got diabetes?
Can you have implants if you've got diabetes? Absolutely, as long as your diabetes is under control. What do I mean by under control? The measurement that we've got for diabetes is HbA1c, and the measurement is about 7.5. So if you get regular blood tests and it's generally under 7.5, then your diabetes is under control. And the success rates with implants in people who have controlled diabetes is exactly the same as with the general population. Now, if the measurement is above 7.5, let's say 7.5 to 10, then you've got moderate diabetes. Or if it's above 10, then it's severe diabetes and it's not under control. You might need to speak to your GP to get some medications to get it under control, but I'll talk a little bit later about what else you can do to improve the situation. But what we know about people who have implants and diabetes is that if diabetes is not under control, then healing is impaired. Then initial stability of the implant might suffer, and also you're more likely to develop long-term complications in the form of gum infections associated with implants. It's a condition that's called peri-implantitis. So when we do implants, we want short-term and long-term success. We want good healing, we don't want infections, and we want long-term stability. So we want to maximize our chances of success, and therefore it's generally recommended to ensure that that either you don't have diabetes or your diabetes is under control.
Have you seen any patient that have been able to reverse or improve from this condition?
Oh, we've got a patient who's an absolute inspiration to me. His name is Peter. We've made a video about him. He came to see me a few years ago, petrified of needles, and his endocrinologist told him that he's no longer responding to his regular diabetes medications and he needs to inject himself with insulin. And he shared this with me simply because he was just terrified of having to inject himself every day. We had an interesting conversation about it. I shared the research with him and he embarked on this inspirational journey. He's changed his nutrition, he's changed what he eats. He's taken on a plant-based diet, whole food plant-based, and the results are absolutely incredible. He had high blood pressure, he's completely reversed high blood pressure, completely reversed cholesterol. His diabetes has significantly improved, and he's come off a lot of medications. He's on a very low dose of diabetes medications now. He's an absolute inspiration to me. Now, I had another patient who walked in through the door the other week, and she inspired me to make this video. She said to me that she had a conversation with her GP, and she told her GP that she needs to have implants done to replace her missing teeth, and that she's spoken to me about doing some bone grafting so that she can have these implants. Her GP advised her that she cannot have implants, that she needs a denture because her diabetes is out of control. So she came to see me about this, and I had some better news for her than her GP. So I explained to her that it is not advisable to have implants if her diabetes is not under control. However, she can implement a number of lifestyle changes to improve her diabetes even without increasing her medications. Now, I'm not saying to come off diabetes medications, that's the wrong thing to do. But the right thing to do is to change your diet. A whole food plant-based diet is the way to go. And get your doctor to monitor your medications and reduce your medications as needed, because this works. It is so powerful that some patients' diabetes improves so much that they don't need to take medications anymore. What do we know? There is a plethora of research out there. Some of the names I can mention to you to look up. Neil Barnard did a lot of research in America on diabetes, on how to reverse diabetes. Another interesting study is the Adventist Health Study. 61,000 people were studied, so a very large study. And what we know from that study is that people who consume meat and dairy have the incidence of diabetes at about 7.6% of the population, and people who eat whole food plant-based diet have the incidence of about 2.9%, which is more than half. Half of the meat eaters. And there are incremental improvements if you reduce meat consumption, if you stop meat consumption, if you reduce dairy consumption, you will incrementally benefit from those changes. But if you want to significantly improve your condition without medications, then you really need to look at a whole food plant-based diet. And again, I'm not saying to drop your medications, incrementally reduce medications guided by your doctor.
Was Peter able to get implants after he implemented those changes?
Oh yes, absolutely. Yeah. He is walking around with that implant, and it's been many years, and we see him for his regular checkups, and he keeps inspiring me because every time he comes in, he's looking healthier and trimmer. And I should have mentioned earlier, there is a video that we have about Peter, and Peter talks about his experience in that video. We should put the link below.
If I want to inform myself better on plant-based nutrition, who would you recommend?
I would recommend to find a general practitioner who is knowledgeable in treating conditions with nutrition. I would recommend to go to the website called Doctors for Nutrition. It's a wonderful organisation here in Australia, and it's got a list of doctors who are knowledgeable in this area. So go to their website, find a practitioner and go and see them. Get them to help you with this and monitor your medications at the same time. I promise if you do it well, we've got plenty of research that's telling us that this works. This works, it works better than medications.